Hello, everybody. Welcome to the COVID-19 Town Hall. Questions, vaccines, are they safe for women? I really appreciate your attendance today. We have a great panel, Dr. Kristy Ritchie, Dr. Kristina Loomis, Alissa Daley, who are ready to share their expertise and opinions with you. Please feel free to ask any question that you want. There's only one ground rule, and that is let's be kind to each other throughout this session. If you want to type in on the Microsoft Teams chat box, the questions will be picked up here and relayed to the panel. If you prefer to remain anonymous, you can click the anonymous button. And with that, we'll go ahead and get started. Kelly, first question.
Yes, go ahead and introduce yourself. So I'm Dr. Kristina Loomis. I've been an OB/GYN uregenicist for about 10 years. And just to give a little bit of personal insight into this, when the vaccine was made available, actually my office manager texted us and I was there immediately afterwards and told her I might be a couple-minute late for patients. Personally, I was very anxious to get the vaccine. I wanted to make sure that with the exposures that I had at work, that I wouldn't bring anything home, as I have some family members that have some major medical comorbidities that really could have increased the risk of major complications from COVID-19.
I'm Dr. Kristy Ritchie, and I've been from this area, and I've been practicing here for about 10 years as well. And similar, my office manager texted on my day off, said, hey, they're offering vaccines today, and so I came in and got it. My husband got his as soon as he could as well, and my 12-year-old got hers on her 12th birthday.
And my name's Alissa Daley. I'm a nurse practitioner here with the OB/GYN group. I've been with Genesis for about 10 total years. When the vaccines first came out, I was actually on maternity leave, and so I was doing lots of research from home. And I'm a breastfeeding mama, and when I came back to work, I knew I was going to be around the virus, and I wanted to protect my baby with the antibodies, so I went ahead and got the vaccine myself as well.
Great, I'm going to restate the question. Some people are having trouble hearing, so I'm going to try to talk a little louder. We're going to talk about now how safe are the COVID-19 vaccines for women, especially those of childbearing age.
I've been telling all of my patients that I consider the vaccine safe, whether that's somebody who's planning on conceiving, who is already pregnant, and someone who's breastfeeding as well. So I've been encouraging all of my female patients that, especially if they require specifically what my thoughts are, I've been encouraging them to get the vaccine.
Yeah, same thing. I mean, I think this week with the FDA approving the Pfizer vaccine, it's given it's had people kind of reconsider and rethink what they were waiting on. And so the FDA approval really just kind of underlines the safety and the longer term data that we're now coming out with that says it's safe and recommended. As far as pregnancy and around pregnancy, almost all of the national organizations that are experts in obstetric health are strongly recommending a vaccine for pregnancy or breastfeeding or planning to be pregnant. And I think at the beginning of this pandemic, with the data that we knew about mRNAs, we were kind of saying, well, you could get the vaccine, it would be okay for you to get the vaccine. And now with the data we're seeing about pregnant women around the nation are getting very, very sick, and we're ending up in some places with pregnant women on ventilators. And so we've now moved to really the recommendation is that pregnant women should get the vaccine.
Okay, I've just gotten some information that it's hard to hear, and we're requesting if we could move a little closer to the monitors where the microphones are. We'll do that with our mask friends. See if this is any better.
Where are they?
Okay, don't forget to type your questions in the chat. Are we ready for our second question? All right. Are the COVID-19 vaccines safe for pregnant women?
Let me restate that in case you can't hear it. Are the vaccines safe for pregnant women?
Yeah, so the initial studies for the vaccines actually didn't include pregnant women or breastfeeding women, and we have now done ongoing research that continues to be ongoing, and we are finding that it is safe for women to receive it during pregnancy, women who want to become pregnant, and for women who are breastfeeding their babies. We've actually found some protective benefits too, that the antibodies are passed to the babies when mama gets it while she's pregnant and when she's breastfeeding.
And again, so if you didn't, I don't know if you could hear the last statement that I was saying, but the nationally, we're seeing that the Delta variant is actually more aggressive for younger people, and nationwide, they are definitely seeing pregnant women getting very, very sick with COVID infection. And so the vaccine has moved from the you could get it while you're pregnant to really, it is highly recommended, a strong opinion statement. You should get it while you're pregnant to help protect both you and your baby. So I think, you know, originally we were people were a little hesitant with the lack of data, but our data is coming out now stronger and stronger, saying you should get it because COVID infection and pregnancy can be very detrimental to both you and your baby.
And that's one of the things that I usually emphasize with my patients too. We haven't seen anything that's telling us that the vaccines are not safe in pregnancy, but we have a lot of information telling us that COVID-19 itself is not safe in pregnancy. It can be life-threatening to you. It can cause problems in the pregnancy itself, preterm delivery, preeclampsia, C-sections, all sorts of things. And as the virus has been out longer and longer, we're seeing more and more of those complications. And so when we have to kind of weigh those two things against each other, the vaccine is definitely the much safer option.
With the vaccine, you know, they started giving it to healthcare workers. There's a pregnancy registry that was started, and it was app-based. It was very easy to report side effects. So they do have data from tens of thousands of healthcare workers, and now more people that have received this vaccine while they're pregnant. And really, there's nothing raising alarms. So we all have seen our patients personally that have gotten pregnant after vaccines, have gotten vaccinated while pregnant, had normal healthy pregnancies, and we have all seen people who have had COVID while they're pregnant, the actual COVID infection, and have had some not so great obstetric outcomes from that.
All right, we have another question. Dr. Ritchie, this is referring to the website that we sent out earlier in one of our emails. It says the website that was sent out stated, no evidence that the vaccine can lead to loss of fertility. While fertility was not specifically studied in the clinical trials of the vaccine, also reports of the vaccine changing menstrual cycles. I understand there are now some women of all stages of pregnancy starting to report their experiences, but with such little data and nothing on long-term effects of fertility, how can you confidently tell a woman the vaccine is safe for her? Along with women already struggling with fertility issues, how do you ease their concerns?
So probably the best website or the best group that I've looked at for that specific data is the American Society of Reproductive Medicine, ASRM. And they actually published a nice study at the end of June through Fertility and Sterility, which is their kind of infertility magazine. And it was a group of infertility docs who compared embryo transplants, so IVF patients, and they compared people who had antibodies because of the vaccine versus people who had antibodies because of actual infection versus people who had no antibodies at all, so had neither exposure. And the fertility rates were equivalent. There was no change in the ability to get pregnant whether you had antibodies or not. So that's a really nice study that kind of demonstrated that we're not seeing a decrease in your baseline fertility based on the vaccine.
And I also have another study I found, kind of similar findings on Reproductive Biology and Endocrinology journal, and they did an IVF cycle prior to receiving the vaccine and kind of checked out the quality and quantity of eggs, and then after the patients, both the husband and the wife, after the mom and the dad both received their vaccines, and they actually found very similar number and quality of eggs with the retrieval cycle after their vaccine. And actually I think that 3 of them went on to conceive after they had a successful pregnancy after the vaccine, whereas none did before the vaccine. So that was interesting.
And you know, we did reach out to one of the infertility doctors in Columbus that we refer to regularly, and he also is highly recommending the vaccine for his patients. So.
Okay. Next question: does getting a COVID-19 vaccine increase the chance of other pregnancy complications like preterm labor?
So we haven't seen anything with the vaccine itself causing increased risk of complications. And that's, I think, one of the most reassuring things, because like I said, we know in COVID, we have been seeing those things like preterm labor. preeclampsia, which is a blood pressure condition. We've actually seen increased risk of C-section, and I think some of that's not clear of these preterm deliveries and C-sections. Is it because the patient is so sick from COVID itself, or are those things related to the actual virus that's causing these problems? But we are not seeing those issues with the vaccine.
And the benefit of the vaccine is that so though people are still sometimes getting COVID once they've been vaccinated, it is a much shorter course. It is a much less severe course. So there's a lot less inflammatory markers that are kind of running around in your body, and those inflammatory markers are probably what's leading towards some of the complications with pregnancy. We see that with people who have abscesses or that type of thing. And so the vaccine is shortening that course and shortening that risk, even if you do get COVID after you've been vaccinated.
Next question. What are the data we have seen of the adverse effects that have occurred in women who have received the vaccine? So what types of things have we seen? Blood clots, thrombosis, palsy, etc.
So I think maybe this question is geared a little bit towards, as the vaccines were coming out, there's Pfizer and Moderna are mRNA vaccines, and then the Johnson & Johnson vaccine is an adenovirus-based vaccine. So there's kind of two different ways of developing vaccines. And during the kind of rollout of the Johnson & Johnson, they paused because they noticed that there was a slight increased risk of a specific kind of clot that went with low platelets. It's not quite the same as like a DVT or a blood clot in your leg, which so it caused a little bit of pause. But then when they went and looked at the data a little bit more, it was something ridiculously small, like 6 out of a million or something.
Right.
I don't know. It was ridiculous.
And those clots occurred at twice that rate in people with COVID.
Right.
Right. So I think that one hit the news quickly, and then when they compared it again to the people who had COVID infection, the rate of that specific weird kind of clot is much higher in COVID infection than it is that vaccine. So I don't know of any significant side effects for the mRNA vaccines that have been publicized or even seen, or
not specific to females. I mean, everybody has seen the news reports recently about some young men in Canada getting myocarditis after receiving the Moderna vaccine. But again, when you do a large population-based study, those things crop up anyway. And so it's not, the FDA has not felt in our population that that's been higher than the population-based risk.
And of course, we'll see things like allergic reactions to anything. I mean, you can be allergic to watermelon or strawberries at any point in your life too. And so that's the thing, we can't predict who would necessarily have an allergic reaction, but that rate has been very low as well.
I would point out that the common belief is that mRNA vaccines haven't been studied for long. In fact, they have been studied for over a decade in other diseases. And so there is a long track record for the safety of mRNA vaccines that's got a very good longevity of data.
Yeah, and even with the adenovirus, the Johnson & Johnson vaccines, they use a very similar one for the Ebola virus, actually. And so that's been around for a while as well.
Okay, next question. I've been told it's hard to hear the question, so let me see if I can be a little louder. Are there patients out there that have been vaccinated before they were pregnant and have become pregnant since? Just making sure that fertility is not affected by the vaccine.
Yes, I think we all have patients right now that are pregnant who were vaccinated just before they conceived, or even, just within a couple of months, or they found out they were pregnant right after they got their second shot. And those are people that actually, if they were in healthcare, they're due now. And so we're seeing that at this point, and they've had uncomplicated normal pregnancies.
I agree. Yep, we have lots of patients that have had the COVID vaccine before, during pregnancy, and we really are not seeing any change in fertility rates.
Next question. I'm in my 3rd trimester and recently received my Tdap vaccine. Is there any recommendation to wait between getting that and the COVID vaccine?
No, initially they said to wait about 2 weeks, but actually now we're finding that you don't need to wait to get your flu shot. You don't need to wait to get your COVID vaccine. You can get it at the same time, because we're trying to time these in your system so that way the baby has some protection at birth as well. And so doing the recommended vaccines we shouldn't be telling patients to necessarily wait. If they're worried about side effects, if they're worried about fevers and or feeling a little run down, then they can space them, but there's no reason that you have to.
Okay, next question. For a breastfeeding mom, how long does it take for the antibodies to pass to baby?
I know in one of the studies I read, I think 9 to 15 days was the earliest that it was detected. And then I think at least a month out, in the most recent one I had read, they were still detecting them at similar levels. And so the theory was that they kind of maintain at similar levels. And we don't know exactly how long the baby has protection if they're only getting it from the breast milk. But if they're getting it during pregnancy and breastfeeding, then that would theoretically be a little extra protection too.
Next question. Is there a specific vaccine that you recommend to pregnant patients?
So I usually don't recommend one specifically. I tell people get the one that you can get and the one that you can complete the course. And so because the risk of complication in pregnancy really isn't something that we're worried about, and that risk of blood clotting is so low, if you can only get one shot, go get the Johnson & Johnson. It's really going to be protective. It's going to help you through the pregnancy. The baby's still going to see that benefit. If you can get the 2-dose vaccines, we know the efficacy and protection is a little bit better. So if you can do that, or that's what's readily available, then go get that. And that's the thing here at Genesis, we have those available. So if you're working here, you can get the 2-dose regimen.
Next question. What if a pregnant patient has had a documented clotting disorder and also has natural immunity to COVID from the past infection? Would you still recommend the COVID vaccine? Is there any validity to allowing those with natural immunity and low risk to forego the vaccine?
So I can address the clotting issue. You probably can too, but the as far as the actual COVID infection actually has a pretty high risk of blood clots. So you're much better off having, again, the vaccine as opposed to the true infection, because the risk of blood clots, again, much higher with the actual infection. The J&J vaccine, that type of clot it has a different mechanism of action than a DVT, and so the history of clotting disorder, that really wouldn't really interfere or coincide, but basically they're just saying you should know the risk of that small amount of clot with Johnson & Johnson, but it doesn't have anything to do with the history of a personal clotting disorder.
That is correct.
So, what was the other half of that question?
So antibodies.
Oh, the antibodies. So it looks like the antibodies from natural infection are waning pretty quickly. They don't know obviously exactly how long it lasts, but there seems to be better protection with the vaccine than there is with natural antibodies. So yes, the vaccine would still definitely be recommended even with history of natural immunity and a history of a clotting disorder.
And I would have to say there is some evidence that the combination of natural immunity and vaccine renders a very strong degree of protection.
Next question. Do younger women experience more side effects to the vaccine than older women?
I would say anecdotally, just talking to my patients, we did seem to see that last year, that the older population really didn't have many side effects at all. And the younger patients that were getting it, and again, the side effects are pretty minimal. As opposed, it's just like when you get a flu shot, you feel a little cruddy for maybe 24 hours afterwards, a little bit of Tylenol and, you know, a movie, pizza night was fine, and then you're great the next, I mean, you're fine the next day. So I think we've been doing this long enough, we can kind of remind you to, like, don't get your vaccine the day before you're going power shopping or before your baby shower or something like that. But so anytime you get a vaccine, just like kids, they feel a little cruddy for maybe 24 hours and then it's fine.
Next question. Do the 3 vaccines protect against the Delta variant?
There is pretty strong evidence that they protect, probably not at the high level that they protect for the Alpha variant. So maybe some decrease in level of protection, but still excellent protection. What they do protect against is serious illness. So there is a really, really strong evidence that if you're vaccinated and you're infected with the Delta variant, your infection is going to be milder and shorter than it would be if you're not vaccinated. And I think that we actually have internal data at Genesis that shows that even those rare patients that are hospitalized that are vaccinated, their hospitalization is much shorter if they've been vaccinated than those that are not.
Okay, next question. As a breastfeeding mother who contracted COVID-19 just weeks prior to the delivery of my child, my husband and additional children also contracted COVID-19. Luckily, all of us had very minimal symptoms. My unborn child was born with no issues and is perfectly healthy. Can you tell me why you recommend me to get the vaccine when I've already had the virus?
Well, like we talked about previously, the immunity to COVID-19 after having the virus kind of goes down more quickly than what we found with the vaccine. And so it will kind of give you and your baby a boost of the antibodies there to get the vaccine.
And I'm not sure how old your other children are, but they'll be going back to school if they're old enough, or they'll be young enough that they wouldn't be a candidate for the vaccine at this point. And so that's just another level of protection that you can offer your child, your new baby, at that point at home too.
Next question. Can I get the virus from any of the vaccines?
No.
No, you cannot. This is not a live vaccine. This is not the way it works. It cannot give you an actual infection. It does, again, to kind of rev up your immune system and give you a little cruddy feeling for a little bit, but it is not the actual infection.
All right, at this time, I don't have any new questions. I'm sure that there's some questions that you guys are waiting to ask, so please go ahead and enter something in the chat room. Is there anything that you all would like to add while we're waiting for another question?
I did some research on fertility for guys after getting the vaccine, and there was no statistically significant change in their quality or counts of their sperm. Actually, it went up a little bit, it improved a little bit. So that's reassuring data too, as far as the guys, if there's any guys out there.
Yeah. The only thing theoretical that I saw that could impact is if someone has a fever, it could temporarily lower sperm counts, but that's completely reversible. So it's not something to worry about long term.
Okay, I do have another question here. It says, how do you know there are no long-term effects for women's reproductive system if it hasn't been out long enough to be studied to know that?
I think that's the question that everybody's asking. We don't right now. We don't think so. We have no evidence to show us that we're seeing that. But we still have to weigh that. All of us right now who are young women who are of reproductive age have to make the choice for us, you know, is our risk from having major complications from COVID, you know, worth taking that chance of not getting vaccinated and the chance that there may be something that we don't know about. We know that there are risks from COVID right now, but we don't see anything that makes us think that. And again, these vaccines weren't something that just came out. There have been years of research, layers upon layers of studies of these types of vaccines. It's just they've now plugged it in for the COVID-19 virus instead of what they were using before.
Next question. Where can mama and baby get antibody testing?
Well, so it turns out that antibody testing isn't that helpful, right? It doesn't predict anything that's useful enough clinically to make a decision about, right? So you can have actually these things called memory B cells from previous vaccination, and you can do the serum antibody test, and that number is 0, but you still may be protected. You can have a higher antibody titer that's maybe a false positive that doesn't give you any signal about whether you're really protected or not. So the statistical terms that are talked about are positive and negative predicted value. And for antibody tests, that's no better than a coin flip. So we don't use them in clinical practice because they don't provide any actionable information.
So the reason they're out and about now is basically to make money for the companies that are offering them.
I hate to say it, but I think that's my.
I'll say it.
Yeah.
Okay.
And I'll be honest, over the past several months, if I've had somebody that asked me, you know, we're doing blood work, asked me to get it because they're pregnant and they were still hesitant to get the vaccine, if I've ordered it, they've been negative. Even if they've had COVID recently, they've come back negative. So it really hasn't been helpful. The patients still need to get their vaccines to have protection.
Okay. Next question. If a woman gets the vaccine while she is breastfeeding, how much of the immunity will be passed on to the child? How much will the vaccine affect the child if their only exposure to it is from the mother's milk? after she is vaccinated?
So in the studies, there were no adverse effects on the infant at all as far as side effects the mom experiences from the vaccine. To quantify how much the baby is going to get.
Probably would depend on the amount of breastfeeding that you're doing and that type of thing.
Yes, I think, is it safe to say that there is evidence that antibodies are passed in breast milk?
Right.
There is not information about the level of protection that provides.
Right.
We know in other diseases that the passage of antibodies in breast milk is helpful in preventing diseases, but not specifically.
And typically continues throughout the amount of time that you're breastfeeding.
So in general, antibodies in breast milk is a good thing.
Right.
We just don't have that specific information in COVID.
Next question. Are there any adverse outcomes, such as fevers, being seen in nursing babies after moms get the vaccine?
I've not seen any, I haven't seen any data about fevers in the babies from nursing moms. There are some fevers that people get sometimes, again, within that 24 hours that they're feeling kind of cruddy. And with pregnancy, we would just recommend Tylenol to bring that fever down. But I've not seen anything about babies. And it wouldn't really make sense that the babies would have a fever anyway, because it's not the baby that's creating the immune response. It's the mom creating the immune response, which is what typically we would see the fever, and it's just the antibodies are going through the milk.
It takes a while for the antibodies to get to you. It's not the same day that mom gets a shot. It's,
Right.
a week out or so at least.
Right.
It's kind of the same thing I tell my patients who get their Tdap or whooping cough or pertussis vaccine in the third trimester. You're taking one for the team. You're going to get the shot, but the baby's going to get the benefit. So you're going to get the side effects.
Next question. Many of us will be due for the third dose booster shot of the Pfizer-Moderna regimen soon. How will Genesis handle this with the upcoming flu shot season? Will we be offered the third dose if it's recommended, or will it be limited to a certain patient population?
We don't have a specific answer to that yet. I think it's very likely that as soon as healthcare workers are eligible for it, that we'll offer it. I don't see any reason why that wouldn't be the case. How will we manage that around flu shots? Again, there's no reason to worry one way or the other. We would offer them at the same time.
Right now, the only people eligible are strictly immunocompromised,
That's
right?
correct.
Transplant patients and that type of thing.
We believe that the FDA is likely to amend its authorization for the general population sometime in late September.
Next question. According to the Council on Foreign Relations, normal vaccine production takes 8 to 15 years. These vaccinations took 12 to 18 months. Can you speak to why the timeline was significantly reduced and if all phases of clinical testing were complete?
So normal vaccine production, there really isn't such a thing, because vaccine development has really depended on the disease that's been studied. So there has been more than 10 years of testing of mRNA vaccine safety. This has been tested in Ebola, Zika virus, and a number of other clinical conditions where mRNA safety has been shown. This is just a different protein that it's generating, and so the FDA used the preclinical data from other diseases, and then it has gone through full levels of clinical trials. That's normal standard for FDA full approval of a vaccine is it has to have 8 months of data from a phase 3 trial, and that threshold was just crossed for the COVID vaccine, and the standards were exactly the same as they are for other vaccine development. I hope that helps.
When you look at the average time to develop vaccines, if you look at the years that those vaccines were developed, the technology now is so different from the time a polio vaccine was developed, or even the measles vaccine. And so I've seen that chart online, and the technology and science that we're able to use now is much better and much more up to date. So that's the other reason I think we were able to kind of fast track this, meaning the science was already advanced so much. It was just a kind of a plug in a different protein, and yep, it worked. And so now we kind of skipped that 15 years of trying to figure out how to make it happen.
Preclinical development, right? And so the preclinical development was done over the last decade.
Right.
Next question. If someone has had COVID in the past and has antibodies, what benefits are there in getting vaccinated?
So again, there is strong data that the combination of natural infection and vaccination gives even a higher level of protection than vaccine alone or natural infection alone.
And the length of antibody presence after natural infections seems to be waning and going away faster than what we were seeing with people who have been vaccinated.
Next question. In your opinion, would it be beneficial to give my 2-year-old breast milk in addition to my infant if I received the vaccine? If so, any recommended amount of milk?
You know, I think it's too early to give any formal recommendation on quantity or frequency, but you know, theoretically, it probably isn't going to hurt anything and may offer some protection as well, you know, some antibodies for the 2-year-old as well.
It's a great question. I don't know if there's data.
I was gonna
Yeah,
say,
I was gonna say,
that's an interesting thought. If you have that much milk,
Yeah, if you
Go
have
for
that
it.
much milk, yeah, it's
I
not
think
gonna
the
hurt
last thing we want
anything.
to do is give a recommendation that we don't have any data.
Right.
for,
Yeah.
Right.
Next question. If I can still get COVID and still infect others after receiving the vaccine, what would you tell someone worried about long-term effects of fertility and birth complications?
So we can talk about infectiousness a little bit. I just read a study 2 days ago from the Netherlands where they looked at 23,000 healthcare workers who were vaccinated with the combination of the 3 vaccines that are available in the U.S. There were 161 breakthrough infections in that population. They looked at very specifically of those breakthrough infections, how long and how infectious were those people. The patients who were vaccinated had more than a third reduction in amount of infectious virus that they were putting out, and it cleared twice as fast as it did in an unvaccinated control population. So you can get COVID, yes, but there's very strong data that you're less infectious and your infection clears faster if you've been vaccinated.
I was gonna say, the rest, I think the other half of that question was, the fertility question we kind of addressed earlier, but they really, with that end of June study in fertility and sterility, they really are not seeing any decrease in the amount of fertility or changes in pregnancy rates after vaccination, and there is now good data to support that as well.
And again, we're not seeing complications in pregnancy from the vaccine, but I feel like I'm the negative person here, but we're seeing lots of complications from COVID in pregnancy. And so, again, if you're weighing that and there's benefit, it is safer to get the vaccine at this point from everything that we can see than it is to get COVID itself while you're pregnant.
Next question. How do you know it won't cause disorders in unborn babies?
Well, I mean, I think the question is, can you see the future? And the obvious answer is no. And again, I think when we're weighing the options, nobody's happy that we're in a pandemic or wearing masks and all this kind of stuff. But again, what we do know, and that's kind of what we'd like to just make sure people understand, is that COVID and pregnancy is bad. And the vaccine so far has been showing people less illness, less inflammatory markers, less complications with their pregnancy. So the science behind the mRNA vaccines, again, that has been out for about 10 years, doesn't show any pregnancy issues long term. It's the way that I kind of explain the mRNA vaccines is it kind of flashes the recipe to the cells, and then the vaccine is disintegrated and goes away, and then the recipe is just there for your body. So it's not like it is integrated into DNA or anything like that. So
That's right. The vaccine construct is very rapidly dissolved by your cellular mechanisms. You know, every cell in your body makes mRNA every day, and that mRNA has a very, very excellent system within your cells to degrade that mRNA. Otherwise, we wouldn't have normal cellular development. The same exact thing happens to the vaccine. mRNA helps make a protein, and then your body gets rid of it.
Next question. Since there is still ongoing research being done on pregnant women, does the FDA fully approval involve pregnant women as well?
yes, it does. And when you say they're collecting phase 3 trials, which means after it's been introduced to the general public, they're collecting data on that. And they're not just collecting it on pregnant women, they're collecting it on, you talked about men in Canada with myocarditis, they're collecting all of those symptoms just to see if there's anything that is a correlate. But yes, it does include pregnant women.
And every drug and every vaccine also has phase 4 data that's collected, which means after the FDA approves it, they'll continue to collect the safety signals forever. The COVID vaccine is no different than any other drug or vaccine that's out there in that sense.
And if you want to participate in some data collection, you can get on the CDC website and join their Be Safe program when you get their vaccine. And they'll send you texts at intervals just to check in with you, and you can let them know if you have any new symptoms, if you've become pregnant, anything to add since getting the vaccine too.
I know I did that when I got the vaccine too, and it was pretty unintrusive. It just was a text message here and there. It took 20 seconds to answer.
Next question. How much testing has been done on the 3rd booster shot?
So there's been quite a lot of testing. The safety, I think, has been tested very adequately. I think what's unknown is how much additional protection it's going to provide. And so I think that is ongoing data. And I think there's some kind of controversy about how much benefit it's going to provide, but the safety, I think, has been very well established.
Next question. If mRNA vaccines have been in the process of being made over the past several years, why have they never made it out of animal trials until COVID?
Well, they have made it out of animal trials. They've been tested in human populations for other diseases. We've never had a disease in the United States that's required a new vaccine. And the mRNA was, except for Zika virus, and there's the mRNA vaccine ready for that if that reemerges. Yeah, it just there hasn't been a need.
Next question. Right now, the boosters are only recommended for the immunocompromised. Wouldn't all individuals benefit from a boost in immunity?
Well, probably yes. Again, the FDA is being careful about that approval, so they're collecting additional data before they make that full approval.
I think the other reason that the immunocompromised population generally a lot of times are taking medications that don't allow their immune system to work as effectively, and so they haven't maybe created the immune response as effectively as the general population. So these people are still very much at risk for developing COVID, and so their hope is that giving them a 3rd vaccine will hopefully make them have better immune response.
And there's very strong data to that effect in patients with organ transplant, bone marrow transplant, and cancer therapy, that a 3rd dose raises the immune response. A lot of my patients are really eager to get it in the oncology clinic, and that's we're trying to get it to them as quickly as we can.
Next question. It is very unlikely that we will reach 100% vaccination rate for the virus. Since this vaccine only lessens the chance to get symptoms, not actually stopping us from getting infected, shouldn't we be worried that we will still be spreading the virus unknowingly? Contact tracing will become very difficult. What if we get the virus while pregnant and are unaware? Could this still potentially cause issues with the pregnancy? Are the symptoms the only thing that we are worried about with this virus?
I think there's a lot of good questions built in there. So I think one of the things that we have to worry about and be aware of right now is, yes, you could technically still spread the virus after you've been vaccinated. And that's why we're going back now and talking about masks, and we're still emphasizing hand washing and distancing and being cautious about that to try to reduce that risk of transmission. And so I guess
I do think that natural asymptomatic infections don't generate the inflammatory response that's associated with the bad things that come along with COVID, like pneumonitis, blood clots, cardiovascular events. So what we think, and time will tell, what we think is asymptomatic COVID infections very much less likely to harm you than symptomatic, or the baby, than a symptomatic infection.
The problem is with symptomatic infections in pregnancy, women have a higher likelihood of being ventilated, they have a higher likelihood of being on ECMO. They have a much higher risk of death, ICU admissions, all of these things compared to someone who's not pregnant. And so the thing is that we still see those, the vast majority of those women don't have a lot of symptoms. It's when somebody gets symptoms and they're sick, they tend to get really, really sick.
And that has to do with the just normal physiologic changes that happen in pregnancy with all the extra blood flow and that type of thing.
Did we forget any parts of that question?
Yeah.
That was a really good question.
Yeah.
Really tough.
Yeah.
Make sure, yeah, are the symptoms the only thing we're worried about with the virus?
Yeah, and again, I think it's not it's the inflammatory response that is systemic that is probably the baseline cause of the preeclampsia or placenta problems and that type of thing. So it's not the snotty nose that we're really concerned about. It's that overall inflammatory response.
Yeah, and if you look at the flu as an analogy, for example, I mean, the flu vaccine has never been able to eradicate the flu, but it definitely reduces your chance of dying from it or being hospitalized. And it's entirely possible that COVID will be another one of those things, you know, where what we can't do is eradicate it from the earth, but we can keep people from dying, and that's a good thing.
And I think a good example of that is in 2010, I think it was H1N1 was out and it was a pandemic. And if you were in the hospital, you remember it being a big deal. And I don't remember it being as big of a deal like on social media and in the news and stuff at that time. But people were dying from H1N1. Our hospitals were full of it. And it was incorporated, the H1N1 vaccine was incorporated into our normal flu shot. And so H1N1 is still out there, but at this point we're seeing more immunity from it over the years because we've been vaccinated against it.
Very, very good point.
Next question. You have stated that you were seeing a lot of complications in pregnant women that are unvaccinated and have contracted COVID-19. Do the majority of these women have other risk factors?
I think in our area in general, almost all of our patients have risk factors. Almost all of our patients in some way or other are high risk. I think one of the biggest things that people don't realize is they think they're very healthy, but they come in and their BMI is above 30. Really, you're overweight if your BMI is above 25. And so we know that obesity, that BMI cutoff of 30 can increase your risk already of complications. But again, a lot of this is, and we all grew up in this area, we know that there's a lot more high blood pressure, we see diabetes, and even if you have diabetes, you might have insulin resistance with polycystic ovary syndrome. All of those things can kind of come together, and just one factor after another can increase your risk. And so, yes, if you're gambling and you get COVID, sure, you're probably going to be okay, but if you're someone who's going to be at higher risk of having major complications, you really aren't gambling at what your outcome is going to be.
Yeah, I think that's a very good point. I think the number one risk for ending up on a ventilator with COVID is obesity.
Right.
Okay, that's all the questions I have for now. Anything else that you all would like to share with our group?
I think that any of us are willing to have one-on-one conversations. If you see us around in the hallways or on the floor and that kind of thing, you're welcome to just stop us and ask specific questions. I mean, we are just wanting the scientific education, and we're wanting people to be healthy. The last thing that we as obstetricians want is one of our pregnant patients to end up on a ventilator.
I'd just like to say I appreciate your willingness to be part of this session. The questions have been great. We realize that there's a risk of, you know, folks feeling like we're trying to shove things down your throat. That's not the case. We just want people to be as fully informed as they can, and we want everybody to be safe and healthy. Thank you. Thank you very much for your time.